Now, one great question that Everett asked on Twitter, what's the best age to start getting prostate checkups? One guy that's trying to be proactive.
If you don't have a family history, then age 40 is reasonable. And this prostate checkup is pretty simple. It's a blood test to get your PSA and a rectal exam. You want to do both. You can delay it until 50 if you really want to be bold, but you certainly want to be examined by then so people know what's going on. I don't want you doing anything about it. I want you just knowing the numbers. Once you figure out your numbers, you want to see if those numbers change over time. So I don't want you going off and getting surgery. I know people are fearful of the result of the test, so they don't want to get the test. But the benefit of getting a baseline, especially is you know where you stand, then you can figure out where you're heading. If years from now you want to check it again.
Okay. Cars need tune-ups, and our bodies do too. What would be involved in a body tune-up, not just a physical exam? And how often do we need one of these, and does it differ for men or women?
It differs a lot between the sexes. You ought to tune yourself up on your own by running the engine. That is the best thing for us to do. You really cannot test to safety. You have to live to safety. So if I can get you outside doing half an hour of physical activity or make your job more active so you're getting activity in, and then eat the foods that look like they look when they come out of the ground, the real foods, wholesome foods, those two simple little maneuvers are the best tune-up you can do, but you got to do them every day. That's what makes it work. If you're not doing that, you want to get a checkup, this version of a tune-up, then I think the simple test you get for a guy, the rectal exam we talked about in the prostate test, and examine your testicles, which you can do yourself. And then most guys ought to get there's some type of a stress test done by the time they're age 60. Unless you got a family history. If you have a family history, then you can go earlier. And the other big thing is what I had to do was my colonoscopy. I just turned 50. And the guys missed out a lot, especially in the African-American community, huge problem. In fact, for African-Americans, we recommend colonoscopies by age 45. That's the basic tune-up men and women. Remember, colonoscopy, unlike a lot of other tests, doesn't just diagnose the problem, it cures the problem when it finds it.
Okay.
For women, you want a mammography somewhere in your 40s as a baseline. And then you want to be attentive to basic symptoms. You may have a problem with ovaries, which are bloating, feeling of satiety, like you're not hungry anymore. Those are clues to us you may have an issue with your ovaries. And of course, don't forget your pap smears every 3 years.
Okay.
Simple things to do. Again, the results of these tests, no matter what they are, they present you with fixable problems.
Okay. And you had a scare with colon cancer, and how has that affected how you look at cancer now, maybe differently before your scare?
Well, thank you for asking. I had, before we started the season, I had my 50th year birthday party, and I bragged at the party that I'd go ahead and get a colonoscopy as my present to myself. So I was, riding high and thought it wouldn't be an issue because I eat right, don't have a family history, I don't smoke, I'm not overweight.
Right.
So, like a lot of people, when I had the colonoscopy, they found the polyp, a precancerous polyp. So it sets you back a little bit. Now you realize you're not Superman. Now you realize that no matter what you do right, there's some things that you got to figure out through testing. Now listen, there's some things you could learn in life, some things you're never going to figure out in life. If it's knowable, know it. Figure out what's going on in your body. So I learned that if you're arrogant about it, you can cost yourself your life. You can grasp defeat from the jaws of victory. Who wants to do that?
Right.
I also learned that if you're in the system and you're smart about it, people will take care of you. And the social support you get when you're not doing well, I'll tell you, it's what makes humans humans. It's why our species has survived, because we'll chip in and help each other.
Now, colonics.
Ooh.
How do you feel about those?
Well, unless you like the feeling, I would not bother.
Okay.
Some folks enjoy the feeling, I'm being facetious, but hopefully no one enjoys it enough to get them. The reality is when you defecate, when you go to the bathroom, the reason Oprah and I always kidded her about the S-shaped poop is because that's what it ought to look like when it comes out, since that's a cast of your rectum. That's what your rectum looks like on the inside. So when you go to the bathroom, if you're eating a healthy diet, everything comes out of you, nothing's left behind. So the colonics don't take anything out except a little bit of residue. And you don't have to eat off the colon wall. There's no point washing it all out. It's got bacteria that's healthy for you. It's like having douches for your vaginal space. That doesn't make any sense. Women used to do it a long time ago. They thought that it made them cleaner.
Right.
But that's not dirty down there. You've got healthy bacteria there. The bacteria is there to protect you, to keep you safe. So why would you want to risk your life and cause potential damage by changing the very delicate flora, the very delicate culture down there? And same for colonics. I don't think it's worthwhile.
Okay, so no benefit.
No benefit. And that's been looked at, by the way. It's not been my personal philosophy. I don't know of a gastroenterologist, a doctor who's a specialist in the colon, who thinks that it makes sense to have colonics. If you want to eat right, you will empty it out by yourself.
What are some natural ways to fight allergies? I really hate taking medication.
Well, one for sure is called Butterbur. Have you heard of that?
I have.
And butterbur has been used in Europe especially, very effectively. In fact, it's as good as antihistamines in most studies.
Okay.
It works that well. Yeah, the other thing that I love is a physical thing. It's the neti pot.
Yes,
Right.
I have butterbur. I actually bought it to combat my migraines.
Does
I
it
read
work?
that it was supposed to work for that. It hasn't, but we're going to talk about our migraines because we talked about those the last
Yes.
time you were here.
Okay, we'll
But
talk about
and
it.
I also have the neti pot, and I love it. But unfortunately, I don't use it regularly. I oftentimes use it when I'm having a problem, not preventative, more so like, oh, my sinuses are really acting up, and then I start using
Do you
it.
brush your teeth every day?
Yes.
I thought you might. It's very beautiful
Twice
teeth.
a day.
For all the guys
Sometimes
out there who are interested, she's beautiful teeth as well. You know, the neti pot ought to be used every day. It's the same kind of thing.
Wow.
You know, when you brush your teeth, and you do it again for general hygiene, makes you feel better, but it also is preventative.
Okay.
So the neti pot just takes 10 seconds to do. You need a little bit of warm water and some salt, mix it up and pour it through one nostril, runs its way through. It clears out all the pollen, so you reduce the allergies. It can help clear out bacteria and mucus that's stuck to you. You'll have less sinus issues, which is why I think it makes a lot of sense for folks to incorporate. The other thing, can I say, you have very beautiful dark hair. The other thing, I'm pitching for her. I'm going to marry her off today. But your hair, because of its nature, it's a little curly, it's going to hold on to pollen.
Okay.
So one thing that's really important for folks to do, especially now because it's pollen season, and a lot of it's tree pollen and ragweed pollen, it sticks to your hair. So when you get home at night, wash your hair.
Every day.
Yeah, every day. You don't have to wash with soap, but you're going to wash the pollen off it.
Okay.
So I don't want you killing your hair by washing it too much with soap, but just rinse off the pollen. Then when you lie down, the pollen doesn't go on the pillow. Then when you turn your face into the pillow, you're not inhaling the pollen. Otherwise, you're going to wake up in the morning with swollen eyes, and just sort of feeling sniffly all the time. You can avoid that.